Hello, and thank you for tuning in to Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobby Pritt, Interim Chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic in Rochester, Minnesota. With me today is Dr. Bill Morice, the President and CEO of Mayo Clinic Laboratories. This is our weekly discussion with Dr. Morice, in which we learn about updates in the field of laboratory medicine and pathology.
Hi, everybody. Welcome to our latest Answers from the Lab podcast. Today, I'm really pleased to be joined by a special guest, Dr. Lebovitz, and we'll introduce him more in just a second. As you know, Mayo Clinic Laboratories, its focus has always been making available to patients the advanced testing that helps provide answers for them and their clinicians that are treating them for the problems for which they're presenting and the challenges that they're having with their health that we can help them with. That's always been at the core of what we do. Of course, in more recent times, we've transitioned from just providing tests provided by our academic department here at Mayo Clinic to tests that are innovative tests from others that are out there doing good things for patients and creating diagnostic capabilities to fill patient needs. And along those lines, I was very pleased to announce just very recently our strategic collaboration with Amprion, a company that's really focused on providing diagnostic answers for patients with neurodegenerative disease. And we're really excited to have them trust us to help give more patients access to their diagnostic capabilities. In particular, is their SAAmplify test or alpha-synuclein test, which is going to go. We'll hear much more about from Dr. Lebovitz, who is the CEO and co-founder of Amprion. So Dr. Lebovitz, welcome.
Oh, thank you so much, Dr. Morice. It's such a pleasure to be here. And I need to say that everything you said about Mayo Clinic Labs facing Amprion feels very privileged and honored to be working with what we think is the premier organization in the world in specialized clinical testing.
Well, thank you for that, for those kind words. For sure, it's great. I mean, I'm really drawn to spend my career at Mayo. I'm very energized by our teamwork values, and so it's great to have Amprion as part of the team now, working with us to provide these diagnostic tests. So maybe before we get into questions about SAAmplify, could you just introduce yourself to our listeners and share a little bit about your background, the background of Amprion as a company?
Sure. First, I'm Russ Lebovitz. I'm, as you said, the CEO and co-founder of Amprion. My background, I trained originally as a physician and a scientist, and I found that my interests coalesced in what we'll call molecular diagnostics and molecular pathology. So I worked in academic medicine for several years, setting up some of the early tests for cancer, and then got very interested in applying these technologies in the commercial world. So I've worked in early, mid, and late stage companies in molecular diagnostics that would include molecular imaging, fluid biomarkers, anatomic pathology with markers for most of my career. And so what we do at Amprion really came out of that, where a technology suddenly came about that I met my co-founder, Claudio Soto at the University of Texas, who developed a tool specifically to detect misfolded proteins, prion-like proteins. And we believed at the time that not only would it apply to the index case, which was Creutzfeldt-Jakob disease and mad cow disease, where it was validated, but it might play a role in all of the neurodegenerative diseases. And it turns out that guess was validated.
Wow. Well, that's great. And first of all, we're kindred spirits. So my background is as a translational scientist, the rare extrovert that got drawn into pathology just because of a passion for creating new tools for patients. I've done it all within the microcosm of Mayo Clinic, however. But the idea that you find an innovative technology like you describe for a thankfully rare condition in Jakob Creutzfeldt, and think about other ways to apply it, is very much in keeping with sort of the DNA of how Mayo Clinic and our department and how Mayo Clinic Laboratories operates as well. So maybe could you tell us a bit more then about the SAAmplify test and why you thought your technology would be a good application for the disease that SAAmplify alpha-synuclein testing is meant to detect, and why in particular you chose that area to go after?
Sure. So thanks for that question. As I alluded to in my introduction, we really focus on misfolded proteins, prion-like proteins. And it turns out that in the latter quarter of the 20th century, the idea that proteins could be causing and spreading diseases largely in the brain if they were misfolded it was an index achievement. I think in the 20th century, 2 Nobel Prizes were given for understanding prion diseases. And so what we did was we took a technology. It turns out that the prion-like particles, the misfolded proteins that cause the progression of these diseases, are present in fluids at very, very low concentrations, while they are present in cells at high concentrations. But so what we were able to do was to develop a technology that actually amplifies the presence of these proteins exponentially. So we can detect really a single misfolded synuclein or other proteins in a fluid. And that technology, once it was established and validated, we decided to move forward because we believed, and others did, that these are the core cause for progression of neurodegenerative diseases. And the expectation was if we could detect these at very low level in accessible fluids and tissues, that really we could identify disease extremely early and accurately. And I'd say so far, certainly for synuclein, that expectation has been fully validated.
Wow, that's super cool. I mean, because I'm old enough, I remember when PCR came, I was doing my research, and now the ability to amplify nucleic acids like that, DNA, and really transformed our whole approach to detecting and diagnosing genetic disease. And now to hear there's something similar on the protein side, I'm a protein guy by background, so that's really fascinating technology, and that makes sense. The name of the test as well, SAAmplify. But maybe could you just then talk a little bit more about the test itself and what it's used for, and why a physician might order it or think about getting it, he or she getting it for their patient.
Absolutely. So as we said, we specifically detect misfolded prion-like forms of proteins that cause disease, but they are present usually in a sea of 1,000,000-fold more of the normal protein. And so we really needed something that was very specific and sensitive. And so what it tends to be used for is difficult or either very early or challenging diagnostic dilemmas. And so our first product for SAAmplify is really for alpha-synuclein, because there's nothing that's as nearly as reliable as this in the medical compendium at this point. And so we know that at least 3 different diseases that are well characterized clinically, Parkinson's disease, Lewy body dementia, and multiple system atrophy, are all synucleinopathies. And we know this because over time we see, looking in the brains of people who die from these diseases, they all have some form of misfolded synuclein in cells, and those cells are the critical regions that are destroyed and dysfunctional in each of these diseases. So what we have learned is that since all of these contain misfolded proteins, misfolded forms of synuclein, our test actually can detect all 3 diseases and certainly can distinguish between Parkinson's and Lewy body dementia on the one hand, and multiple system atrophy on the other, because they misfold in different ways. And because down to the highest resolution we and others can see, Parkinson's disease and Lewy body dementia seem to have the exact same molecule, the exact same form of synuclein, we've come to the conclusion, and I think the field has, that misfolded alpha-synuclein spreads widely throughout the brain. So even if you have Parkinson's, over time, one can get dementia, one can have autonomic disorders, one can have a wide range of symptoms because it spreads so widely. So we've come to believe that, at least on a molecular level, Parkinson's and Lewy body dementia are the same diseases that hit different parts of the brain at different times, and that multiple system atrophy is another. And much of the data for this has come from our ability to measure the various misfolded proteins.
Wow, that's really at first it's really amazing and fascinating. And that the test itself can have that level of precision, and also give you those sorts of insights into the pathology of the disease itself. On top of that, you mentioned early detection, and I have unfortunately have had the experience of a family member who was ultimately diagnosed with Lewy body dementia. It was a long road. It brought me back to when I did my neurology training as a medical student in the 80s, and the Man Who Mistook His Wife for a Hat was a popular book, and how all neurology diagnoses were really predicated on a neurologist, and so this sort of testing is just so important. Can you tell me what, like when would a physician consider ordering these tests for their patients,
Yeah.
do you think?
So, it's a great question. So I can think of two scenarios that would play out the most. So one, at very early stages of a disease where there might be a family history, or where one has what we'll call for synucleinopathies in addition to the diseases, because they're so widespread, we often see what we'll call prodromal symptoms, things that are abnormal but not completely dysfunctional, that someone may notice 10 or 15 years before they get the disease. The two most common prodromal symptoms for synucleinopathy, one is an unusual sleep disorder called REM sleep behavioral disorder, where in deep sleep or REM sleep, people lose the inhibition they normally have to movement. So when we're in REM sleep, we're stimulating our motor cortex just the way we would if we were awake, but it's uncoupled. In people with RBD and an early prodromal sign of synucleinopathy, that tends to be uncoupled and they move around in their sleep. And usually it's a partner who recognizes this. And it turns out that there are regions of the brain that are damaged by synuclein even before we see the regions that are responsible for Parkinson's or Lewy body dementia. The other is a loss of sense of smell. It can be fairly acute, so hyposmia, and it really needs to be measured. And it's been complicated by the presence of COVID, obviously, over the last few years. But synuclein turns out to damage very early centers in the brain that control olfaction. And therefore, that's an early sign. So people who have either one of those signs, not everyone will go on. It's not always caused by synuclein. Our test will tell you with 90 to 100% accuracy if that very early sign is caused by a synucleinopathy. And if you have one of those signs, it is within 10 years, almost everyone progresses to either Parkinson's, Lewy body dementia, or multiple system atrophy. So that's one case where one might use it. A second is what we've learned that's very interesting, largely from pathologic studies coupled with what we see with our test. And that is that most of the neurodegenerative diseases they have copathology. So where we think of Alzheimer's and cognitive disease being largely a disease of amyloid and tau, it turns out that up to 40% of patients diagnosed with Alzheimer's also have synucleinopathy and have Lewy bodies throughout their brain. So let's say we're now in a situation where someone has early signs of cognitive disorder, and maybe it's a little atypical. Maybe they also have a quirk in movements, or they have some autonomic dysfunction, and that's a significant number at early stages. And they go and get the latest test for amyloid and tau, and they're positive. It's great, but before we decide that this is Alzheimer's and we go down that straight and narrow path, it may be that there's synuclein copathology. Patients with Alzheimer's with synuclein copathology have been shown to progress up to 3 times faster, and then they tend to develop all of the symptoms of Lewy body dementia in addition to Alzheimer's. So really, now that we have the test, once we have amyloid and tau nailed down, if there's anything that doesn't look typical, and this is a lot of patients, we can provide a great deal of help by predicting what the future path will be if they have any signs and they are positive for SAAmplify as well.
Yeah, again, fascinating and really important stuff. First of all, both of those prodromal symptoms that you describe actually were manifest in the individual that I knew, and yet we didn't even. Of course, Amplify wasn't available, so how would you even know? And I think that just getting that kind of insight, and also to patients with Alzheimer's disease, again, a power of a diagnostic is it provides insights into a patient, what the patient is experiencing, right? And can help inform them about what's going to happen over time. And SAAmplify clearly can do both of those things, both in patients with Alzheimer's as well as those with other alpha-syn folding disorders. I'll say it that way. I'm not as glib with it as you are. And I think the other thing that's important really is not just for the knowledge, but now that there's now treatments for mild cognitive impairment that are coming to the fore. It might be important for a patient that's diagnosed with Alzheimer's before they would go on an Alzheimer's treatment to know if they have an alpha-synucleinopathy as well, right? And so, as well as identifying patients for hopefully novel and effective therapeutics for conditions like Lewy body or multi-system atrophy, which can be really quite devastating, or Parkinson's, which is, of course, devastating in and of itself.
Fully agree. The other thing that I can say that's a situation that we've learned because of how powerful this test is. When we look at a clinical diagnosis by very skilled physicians, including those at the top institutions, including the Mayo Clinic, and this is why we have such a great relationship, we've learned that in the best hands with symptoms alone, up to 30% of diagnoses of Lewy body dementia and Parkinson's at early times are not correct. And that is not the diagnosis that same doctor would hold 4 or 5 years later. But then in all of those cases, at that earliest time, SAAmplify tests for alpha-synuclein is positive in those that are truly synucleinopathies and negative in those that are not. So an early diagnosis at a time in a disease that can be very confusing. We often talk about synucleinopathies, and even I have trouble, and that's what I do every day. There's that we call a diagnostic journey. And while we all go through diagnostic journeys, some of these are very unsettling. It can take 2 to 3 years, and even our trusted doctors change their mind as they see new symptoms. So the idea that you could have a test at the very first visit that tells you definitively the path you're going down, it's really important. And we think it's just as important if we diagnose that you do have Parkinson's or Lewy body dementia, or if you don't. When we say it's negative, that patient, if they go through a whole course, and we see their brain at autopsy, almost never have Lewy bodies. So they might have a drug-induced problem, or it might be a tauopathy, but these are so hard to diagnose otherwise. And with a test like SAAmplify, at the earliest time, these atypical cases can be diagnosed early, and we can avoid the diagnostic journey that both doctors and patients dread.
Yeah, for sure. And again, really impact families. When you think about patients with cognitive impairment, often are in the later stages of life. Most frequently, they might be in a living situation where a loved one is trying to help care for them, or they're with another elderly person, and they have to understand what kind of support they'll need. All these things so important, and makes those diagnostic journeys, as you say, even more stressful for the families and for the patients that are experiencing these things. So that's why I'm hematopathology. I'm blood disorders, not neurologic disorders, but that I'm just I so admire the work that you've done, because I think it's really important to have the ability to see an observation that's made in an academic setting and say, wow, this really could have an impact on these different sorts of conditions or diseases, and then establishing Amprion to actually make those sorts of that groundbreaking science really available to patients in a way that can really help with their care. So I congratulate you on the work that you've done. It's great, and just makes me even more proud to be working with you to make this test more available. So is there anything else that we didn't cover that I should have asked you or should cover?
Sure. Let me just say two things that may be helpful. One, look, our relationship with Mayo Clinic Labs really stemmed from a long-standing relationship with Mayo Clinic doctors and scientists in both Rochester and Jacksonville. And they really, over time, compared the validity of our test in their hands. How did, when they have a difficult case, if they had our test or sometimes another test, for example, for total synuclein or phosphosynuclein, how did our tests compare with what they diagnosed and what they saw at autopsy when the patient passed? And it turns out that ours predicted so well that in their hands, they wanted to have it in Rochester and in Jacksonville. And that ultimately led to the relationship with Mayo Clinic Labs, where Mayo Clinic Labs says, well, if they need it in Rochester and Jacksonville, why wouldn't everyone need it? So that is one thing. And we're very pleased by that. And look, it could have turned out another way. So we built something, but we relied on the best doctors in the world to determine how valuable it was. And then because of that, and because of the high performance, I'd say it's very unusual that our test has been carefully reviewed by very respected third parties. That would include the US FDA that issued a letter of support that's very unusual, the Fox Foundation, the Critical Path Institute, all of these third parties who we don't pay, we're just another aspirant to having something important. They've all carefully reviewed the data. In some cases, they generate the data, and they've all come out strongly supporting this as the definitive test for a synucleinopathy at early stages and at late stages.
Yeah, that's very validating for you and for the work that you've done, because it's one thing to have the science, but then to do all the work to really establish it as a clinically reliable tool, I think cannot be underestimated. And Amprion's done that. And also, I mean, that's the purpose of Mayo Clinic Labs is to help make innovative tests and diagnostics available to as many patients as possible. And it's great that you participated in the internal ecosystem, and now we can partner to bring that technology, that your SAAmplify testing out to as many patients that will benefit from it. And it sounds like there'll be a lot. So I want to thank you for your time today. Thank you for the partnership. And I look forward to hearing more about Amprion. It sounds like this is just the beginning. So I'm sure the good things to follow.
Good. And I want to thank you for everything you do as well, both for Mayo Clinic Labs and just getting the word out on diagnostic tools that patients and doctors need. So thank you.
Thank you for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and tune in every other Thursday for new episodes.